In this video, I'm going to talk about the emotional blunting that you can get when you take antidepressants. I'm Dr. Tracy Marks, a psychiatrist, and this channel is about mental health education and self-improvement. I post videos every Wednesday, so if you don't want to miss one, click subscribe. If you've ever taken an antidepressant such as Zoloft or Lexapro, you may have noticed that after a while of taking it, you feel emotionally numb or dulled. It's as if you can't experience normal emotions, or as if someone's holding you back. Some people will even say that they feel like they just don't care about things anymore, and they question whether they're getting depressed again. This problem is pretty common, and it's thought to occur in anywhere between 30 to 50% of people taking serotonin enhancing antidepressants, and yes, that's a lot of people. The antidepressants that we use fall into two main categories: the ones that enhance serotonin and those that do not. The main brain chemicals involved in mood are serotonin, norepinephrine, and dopamine. And most of the antidepressants increase serotonin levels in your brain. Two of them enhance or increase serotonin and norepinephrine, and only one of them increases norepinephrine and dopamine and doesn't touch serotonin, and that would be Wellbutrin. There's still some debate as to why exactly the emotional blunting happens, but here's one of the main working theories. When you get increased serotonin from the medications, the extra serotonin, through a feedback loop, decreases dopamine secretion. This decreased dopamine causes blunting and apathy. It's almost like an overshoot of having too much serotonin around, and it dampens down your dopamine. So what can be done about this? Well, first of all, this would be changes that your doctor would make to your medication regimen. It's not something you would do on your own, but this is just for your education. If you have done pretty well on the antidepressants for a while, but for this one problem, sometimes lowering the dose can resolve the problem. Sometimes adding Wellbutrin to your regimen can help because it increases dopamine. And of course, this is only if the Wellbutrin is compatible with the other medication that you're taking. Sometimes it's not, and your doctor can check those drug-drug interactions. If you don't have much anxiety, taking Wellbutrin alone may fix the problem. And this is because anxiety normally responds to the serotonin-enhancing antidepressants. In fact, serotonin medications are what we use to treat daily anxiety. So they're actually antidepressants and anti-anxiety drugs. Wellbutrin, on the other hand, also called bupropion, that's the generic name, it's a great antidepressant, but it doesn't do well for an anxious depression. If you do have a lot of anxiety, or you've tried Wellbutrin before and you can't take it for some reason, you can try a different serotonin-enhancing antidepressant. Just because you got the dulling effect with one medication doesn't mean that it will automatically happen with the rest. And there's lots of options, including the serotonin norepinephrine drugs like Cymbalta, or the serotonin receptor drugs, we call them, such as Remeron or Trintellix. So that's it for today. Just a quick note about that dulling effect, and to give you some information about why it happens and how you can improve it or resolve it. I see a lot of, it's really unfortunate. I see a lot of people who'll do well on their antidepressant for a while, and then all of a sudden it just kind of goes real dull. And unfortunately, the people who tend to be the most creative, in my experience, tend to be the most sensitive to this problem. They noticed a dulling of their creativity. And if that's the kind of work that you do for a living, then that's just not going to work at all. So sometimes you may have to switch in and out of medications, and try different add-ons and things like that to see if you can get something that still leaves you feeling sharp and functioning well, and while at the same time treating your depression. Let me know in the comments if this has happened to you and what fixed it. How'd you get around it? What made it better? That's, of course, if you're so inclined to give that kind of information in a comment. Take care.